So let's get back to New Mexico. There's been a lot of talk about what states should get the most federal help. Some leaders have said it's been lacking.
We wanted to know our own governor's take, so our joywang spoke with Governor Michelle Lujan Grisham earlier tonight.
Well, let's start with personal protective equipment. We're talking about gowns, masks, gloves, things healthcare professionals need to provide care and test for COVID-19. The governor says getting enough of that alone, that necessary equipment, has been a huge nightmare. And now states are even competing against each other.
The way that you get it in an emergency, you don't order it in the same way. You go through the national stockpile. Well, nobody got their allocations. When we did get our allocations, a percentage of them, it's all equipment, by and large, we can't use. They knew that. Expired, torn, dirty, opened, terrible. All right, that's an outrage that the federal government would do that. They should have fixed that. Two, they told governors, you're on your own. Governors, including me, we scoured the universe. All right? They're coordinating what I believe now to be price gouging. They're paying more than folks ought to be paying. They're not requiring the companies be fair. They said they were signing an executive order. I haven't seen it, effectuate pricing anywhere. They're not requiring manufacturers to actually make us more stuff so that we can get more stuff. And now FEMA's involved in interrupting our orders.
Now, Governor Michelle Lujan Grisham says she does appreciate that we have FEMA on the ground in New Mexico. She's had a number of conversations also with the vice president, as well as the task force he's heading about these problems. The state can call up the National Guard for field hospitals and food delivery. But her concern is a lot of what's happening now is reactive.
This whole effort where it looks like it's sort of whack-a-mole. So we're now going to put all of our resources in the states that have epicenters. They should we all should, every American should care about what's going on in New York. And we should all do our part. But when we only focus there, and that state, that governor's very upset about the same issues I am, and then you don't do any of the other work for supplies and testing for another state, then you wait till we're at epicenter, right? So now Louisiana is a problem, right? So we just keep chasing all these problems instead of preventing them. And that's incredibly worrisome to me.
New Mexico is supposed to get a shipment of supplies on Thursday, the same supplies we told you states were competing for earlier. But again, the governor says getting that was harder than it should be.
And we purchased more than 100,000 N95 masks, and they're supposed to be delivered to New Mexico on Thursday. And I tell you this a bit reluctantly, right? Because when we ask about, we want to see the tracking information. It's not available. Show us, shipping information. Oh, well, it's coming. Don't worry about it. But this is the experience that every state has had, including ours. And we've been very redundant. It's not our only order. It's not our only effort. We've even gotten New Mexico companies who are donating and making equipment. But it shouldn't be this hard. And I shouldn't have communities who are worried about having that equipment so that their loved ones and hospital workers and healthcare workers are protected.
President Trump has said he wants the country back to business by April 12th, Easter Sunday. That's just a couple days after the current health orders in our state will expire. Health orders that could be extended depending on how our state is doing. So we asked the governor what she thinks about the president's timeline.
I'd love for people to get to go back to work. I would love for our economy to start rebounding. I would love for people to be safe in that environment. I see nothing from the White House that gives me any sense that that's true. And when you start to have community spread like we are now in this state, the actual data suggests that within a 10 to 14 day window is when you have your biggest significant issues to address. Way too many people in a hospital and other serious health and public safety issues. So it flies in the face of everything I know from his own departments, like the Centers for Disease Control and Health and Human Services. So I just don't see that it's relevant. But if he'll show me a data point, I'd be happy to utilize that in our policy making.
Across the country, there have been cases in which the risk of transmission means those with coronavirus can't have visitors. That's a sad reality the governor hopes our state won't have to face, where our loved ones are in the hospital and we can't even say goodbye. Steve?